Hello again. Welcome back to my channel. I appreciate you joining me. Good afternoon, good morning, good evening, depending on where you're at and when you're watching. I appreciate you joining me today. And as you will see, I have a sign above the toilet in my first floor restroom. This says Sanjay Gupta peed here in June 2018. And today I want to talk about that story and then go a little bit beyond it. So in 2018, I was sort of at the end with my depression. Well, I wasn't sort of at the end, I was at the end. I suffer from MDD, Major Depressive Disorder, as well as PTSD, post-traumatic stress disorder. I was molested as a kid and get to deal with that, as so many of us unfortunately do. But in 2018, the depression had taken a major toll on me, and I was done. And over the decades, various psychiatrists have had me on many different medications. None of them worked. Some of them had side effects that were intolerable, etc., etc. Those of you who are dealing with depression understand fully what I'm talking about. And so in probably March of 2018, I had decided enough is enough, and it's checkout time in this room. So, my psychiatrist could sense that that I was on a downhill slope. And when I called on that Friday and canceled my appointments with him and with my therapist, my psychiatrist was concerned, and he left 2 voicemail messages for me during the day, and I didn't respond. And then finally on the 3rd call I answered, and he expressed his concern for me and asked me if I would try one more thing. He knew I would not do ECT, but there was a new drug called ketamine. Not a new drug, but a drug that an old drug that was being tested for a new purpose, which is ketamine. Ketamine is an anesthetic. It's been around for 50 years or more. It was used heavily in Vietnam in the field. And it is a sort of a psychedelic, and it's called a dissociative drug. So during the infusion with ketamine, your brain kind of dissociates from the rest of your body. So it's like your body is there and your brain knows it's there, but they're not attached. At any rate, I decided that I was going to do a little research. I wanted to see what Sanjay Gupta had to say about ketamine for depression. Most of you, I'm sure, know who Sanjay Gupta is. Dr. Sanjay Gupta, Chief Medical Correspondent for CNN, and he is a world-renowned neurosurgeon, and just an all-around great guy. So I wanted to see what he had to say about it. Could find absolutely nothing from him, but I decided, okay, I'll try it. I didn't expect it to work. You'll see that in the video, and it did work in a major way. And I am going to now play that, and if CNN decides that I'm going to have to take this video down for copyright reasons, then I guess I will have to rethink how to present this. But for now, I'm going to play the product of that. But before I do that, just let me tell you, I reached out to Sanjay at the university where he teaches, came up with an email address for him and reached out to him. After I had the infusion and it had worked so incredibly well, I reached out to Dr. Gupta and said, you know, I tried this treatment. It was amazing the way it worked, and I had hoped to see what you had to say about it, and I couldn't find anything. And you really need to tell people about this because it works in amazing ways. Within about a half hour, I had a reply from Sanjay Gupta, basically saying, thank you for writing. Yes, we've been talking about doing a story on ketamine for depression. I'm going to ask my producer, Ben Tinker, to get in touch with you just to find out more about your experience and such. So his producer then called me within an hour or so. We spent quite a bit of time on the phone discussing it. You know, they're in Atlanta. I knew that there was a ketamine center in Atlanta and encouraged them to reach out to some patients from that clinic just to get their stories. And at the end of the conversation, I was dumbfounded, to say the least, when Ben asked me, would you be willing to appear on camera with Dr. Gupta and talk about this? I realize that it's hard to talk about depression and the stigma and all that, but would you be willing to appear? And I was caught totally off guard because that was probably the furthest thing from my mind when I had reached out to him. I just wanted him to tell the story. And without really thinking, I just said, well, sure. I mean, if I can help get this story out there and we can help other people, then yeah, I'd be happy to. And little did I know that just a few weeks later, Dr. Sanjay Gupta and his producer, Ben Tinker, and their cameraman, Jerry, forgive me, I don't know Jerry's last name, were pulling up in front of my house. And it was surreal. So we spent about 3.5 or 4 hours sitting in my dining room interviewing. And then we all drove over to Ketamine Milwaukee, the clinic in Milwaukee, where I had begun receiving my treatments, and we interviewed over there. So that's how it all happened. That's how I ended up with the Sanjay Gupta Pete Here sign in my bathroom. And I'm going to play that video for you now, and then I'll talk a little bit more after the video. So, get this started.
Could a drug stop suicidal thoughts in hours? Literally. It's an incredible thing to even suggest. Well, there is a drug. It's called ketamine. It's an anesthetic also used illicitly as a club drug, and it's now being used by some doctors who have patients in a serious suicidal state. It comes, as we have learned, calls to the National Suicide Hotline have doubled. And as we remember the lives of Anthony Bourdain and Kate Spade, both lost to suicide. Dr. Sanjay Gupta is out front.
The predominant thought was, I need to be dead. I don't want to be here. And that's for as far back as I ever remember.
Major Depressive Disorder, post-traumatic stress. Alan Ferguson was 18 when he was first diagnosed. Over 35 years, he tried just about all the medications modern medicine had to offer. Did they work at all?
No. I can say that, no.
Alan picked a day he wanted to die, quit his job, gave away his dog, Zeke, and had a final phone call with loved ones. But almost as an afterthought, his psychiatrist asked if he would consider an anesthetic medication known as ketamine.
I wasn't worried about trying something I had never tried before. I was worried about trying something else that wasn't going to work.
Ketamine is widely thought of as a club drug, a date rape drug. But at several hundred centers around the country, doctors have been using it off-label to help patients at real risk of dying from suicide. Some have even referred to it as a save shot. For Alan, it worked, and fast, within hours.
I honestly have never had the experience of waking up and not being sorry that I woke up. I don't use hyperbole, but it is, for me, it's phenomenal.
Alan got his first infusion on May 25th, and his depression went from severe to mild. After a second infusion on June 1st, for the first time in his adult life, Alan no longer had depression. Dr. Kevin Kane gave Alan his infusions.
I tell people that, the ketamine is effective for 70% of patients with treatment-resistant depression.
This is your room.
This is my room.
For about 40 minutes, Alan sat here with this IV hooked up to his arm, a heart rate monitor, and his music.
People talk about hallucinations, dissociations, even out-of-body experience. Do you have any of that?
The first day...
Alan told me it felt like his whole body was on Novocaine, like what you get at the dentist.
We see those side effects, but I don't look at them as side effects. Sometimes that can be a very powerful thing, that dissociation.
Ketamine also seems to target areas of the brain that have withered away due to depression and grow new synapses, as you can see in this rat model. None of this comes cheap, nearly $500 an infusion, with most patients needing up to 6 infusions to start, with boosters every few weeks after. For now, insurance doesn't cover any of it.
Since you took ketamine, have you ever wanted to die from suicide again?
I have not had one single thought.
Not a single thought now.
Not one.
I mean, Sanjay, it's so incredible. Obviously, I know, a lot more to be tested and done, but you're talking about something that could work in literally hours, as opposed to traditional treatments that either don't work at all, or, drug names we all may know, things like Prozac, can take weeks or months. And for someone suicidal, that could be the difference between life and death.
That is the big difference, I think. And you're right, this is early days with regard to using ketamine like this. Ketamine as a drug has been around for a long time, but it's just now being tested in these early trials, and they look promising, but it's that rapid onset, I think, how fast it works, Aaron, that makes all the difference. It can take 4 to 6 weeks for some of these other antidepressants to start working. If you are suicidal, this has been referred to potentially as this save shot, or as this rescue drug, as some of the doctors have called it. So there's not many things that behave that quickly.
So I am going to link down below the link to the full article on CNN Health website that Ben Tinker wrote. And the amazing part of that whole thing is, for me, well, one of the amazing parts is that since then, in 2018, I have maintained contact with Ben, and I'm very fortunate. Very fortunate to have that sort of casual relationship. I was so proud last year when Ben and his husband David had a baby, Beckett, and I'm just so incredibly happy for them and proud of them. So perhaps my sign in my bathroom should say Ben Tinker Pete here, but the reason I'm doing this video and wanted to replay that, I'll tell you a little bit more. I was not prepared at all for what was going to happen after that interview played on CNN. For the next 2 to 3 days, my instant messenger on Facebook went absolutely crazy. People from all over the United States and even other countries saw that and reached out to me because they were in a similar state of being so failed by the antidepressants that had been available, and asking, how do I find this? How do I find this? And and it wasn't just Facebook Messenger. I had people go to the Chamber of Commerce in the village nearby, and ask them, do you know this Alan Ferguson? Do you have any way of getting in touch with him, etc.? And then, they reached out to me and said, hey, we've got these people trying to find you. And so it was amazing the number of people that video reached. And to this day, I continue to get instant messages on Facebook asking for help. So it was great. I just wasn't prepared for it. I didn't think about the ramifications of appearing on worldwide TV. And then a local Madison station contacted me and wanted a local interview, and David Wahlberg from the Wisconsin State Journal contacted UW Health that also has a ketamine clinic, and asked if they knew of anybody that would be willing to interview. And so the doctor came to me and said, that they had this request and would I be willing to interview. So I did. I sat down with David here at my house, and it was a great interview. And I've again maintained some contact with David since then. And it was just amazing. It really was. I'm telling you all this because one of my upcoming videos is going to be talking about the importance of advocacy. And this is a big example of what advocacy can do, the importance that it has in this world. And altruistic works that help other people, and they end up not being all that altruistic after all, because there is an inner reward that comes from doing these sorts of things. Now, I mentioned that I continue to get messages about this, and I also wanted to give kind of an update of where things are at with ketamine. There is a drug called esketamine, E-S-K-E-T-A-M-I-N-E, which was developed as a nasal spray, and it's basically one half of the ketamine molecule. So the ketamine molecule, as I understand it, has an S side and an R side. I think they're called enantiomers or something like that. Well, because ketamine had been around so long, there was no way for a drug company to patent it for this. No way to make billions of dollars off of ketamine. And so they decided to come up with a way to develop something that they could patent and make billions of dollars off of. And that's what they came up with. And I think it's great that it's out there. I have heard very mixed stories about it. The best stories I've heard is that it does provide some help, but I certainly have not heard the kind of raving responses that I hear about the actual ketamine drug. And the clinics that I'm aware of have decided not to offer the esketamine for whatever reason. It's, in some respects, it's easier to administer because it's a nasal spray versus an intravenous infusion. But I think that the results are just not as good as with the IV infusions. And so as far as I'm concerned, the infusions remain the gold standard for this. Since 2018, a number of insurance companies have begun covering ketamine for depression. In fact, my Medicare Advantage plan does cover it. And as well as some states, Medicaid plans are actually covering it now. Very explicitly, the Medicaid system in the District of Columbia is now paying for ketamine for depression. So there have been some strides there, but until the FDA actually authorizes it for treatment-resistant depression, insurance companies are still going to be hesitant on it. And so I continue to lobby the FDA, the Centers for Medicare and Medicaid, CMS it's called, my U.S. senators and representative. I continue to lobby all of them to get the FDA to actually approve it so that all insurance companies will pay for it. So that's exciting, and I wanted to just kind of bring you that update on it. There are some other drugs that are in clinical trials right now for various mental illnesses. And keep in mind that these are all drugs that for 50 years, researchers weren't even allowed to study them because of Nixon's war on drugs. Ketamine only survived because it was in active use in the field in Vietnam. If it were not for that, ketamine wouldn't even have been an FDA-approved drug for anything. So currently, there are, I believe in phase 3 clinical trials is MDMA, or ecstasy as we know it. That one is in phase 3 clinical trials, and they expect to go to the FDA for approval on that one either late this year or early next year. So that one could be approved within a year or so. Another one is psilocybin, magic mushrooms. That is in phase 2 clinical trials. In fact, that one of the clinical trials for it is through a company or a place called the USANA Institute, which is an institute that was founded by Bill Linton. Many of you probably don't know the name, but he is the founder of Promega Corporation in Fitchburg, Wisconsin here. And actually MDMA, the UW in Madison is one of the sites that's in the phase 3 clinical studies for that. Another one that is coming down the road is LSD, and that one will probably go to the FDA for approval in 3 to 4 years. Psilocybin probably 2023, maybe into 2024. So there are a lot of other options coming down the road, some of them with indications for treatments for major depressive disorder, some for PTSD, some for anxiety. So there's a whole host of new medications coming to the market. And one I am most familiar with is psilocybin. And what the research on that has shown is that a single therapy session with psilocybin can last months, if not years. So whereas with ketamine, I go in for infusions every 3 weeks, with psilocybin, it's a once a year or once every other year therapy. So really exciting stuff. And although I was a hardcore Republican and fully supportive of Nixon's war on drugs that has been continued over the years by that party, a party of which I no longer associate, by the way. You know, finally these medications or these drugs are being researched and studied and will soon become available. And the thing that bothers me about it, that I am so ashamed of for having supported the war on drugs, the thing that I am so ashamed of is the number of lives that could have been saved that were lost to suicide and other actions related to mental illness. And I am so sorry for that. Yeah, it causes me a lot of pain, and it's unfortunate that so many Republicans are still hell-bent on refusing to admit that whole policy, that whole approach was wrong. So that's the update. Sorry this video is so long. If you've stuck around this far, thank you so much. If you've liked it, please give it a thumbs up, subscribe to my channel, share the video, share the link, and comment below, please. Always looking for comments, and I will respond to the comments. I also have a Patreon page, which I am still developing. I'm hoping to be able to get some better equipment that will allow me to do some videos other than sitting here at my desk. I have a whole couple of pages of topics that I want to do videos on, and so if you're interested in helping me to kind of expand what I'm able to do, think of joining me on my Patreon page. Thank you so much. I appreciate you sticking with me. Until I see you again, be happy and be healthy. Thanks for joining me. Bye-bye.